So the most obvious function of the female reproductive system is its ability to reproduce. The uterus provides a home for the fetus for its first 9 months of life and development. Once the baby is ready to be born, it is passed through the vagina with the help of several painful contractions. Now, the female reproductive system also provides nutrition and immune support for the newborn for up to or over a year after birth. Now, the female reproductive system also allows women to experience sexual pleasure. Sexual intercourse has more than just physical benefits. It can even improve mental health by increasing confidence, being able to be more in touch with your emotions, and strengthening relationships.
Estrogen and progesterone are produced by the ovaries. Estrogen develops breast, wider hips, pubic hair, and armpit hair. Estrogen regulates menstruational cycle and controlling the growth of the uterine lining during the first part of the cycle, alongside progesterone. When the ovaries begin releasing estrogen hormones in line with each monthly menstruational cycle, the estrogen level rises halfway through the cycle, which helps trigger the release of an egg. This level then quickly decreases after ovulation. The progesterone prepares lining of the uterus so the fertilized egg can be accepted and it can be implanted and developed. Progesterone helps prevent muscular contraction of the uterus that would cause the wall to reject the attached egg.
Keeping the female reproductive system healthy involves both sexual and overall reproductive health. Make sure to always wear condoms to protect from STDs and unwanted pregnancy, and get tested for STDs monthly if you have regular sexual intercourse. You may want to ask to see your partner's STD test results before engaging in sexual activities with them. Starting at age 21, you should also visit your gynecologist and get a pap smear every year or every 3 years. And make sure you always practice good hygiene. Feminine wash is not necessary and may actually do more harm than good.
Now, some things that may cause the female reproductive system to become unhealthy is not having any form of protection during sex, since you are highly likely to possibly obtain an STD. Another factor of how to make the system unhealthy is diet. Obesity can alter the balance of hormone distribution with estrogen and proestrogen. Diabetes can also be a factor for making the system unhealthy, since it can interfere with the female's blood vessels and nerves in the female genitals, thus causing difficulty in arousal and lubrication. Failure to change and remove any female sanitary products can also make the system unhealthy.
Lupus is an autoimmune disease that affects over 1 million people in the United States, and most of them are women. Now, this disease has no known causes, but genetics are believed to play a part in one's susceptibility to developing it in their lifetime. Now, symptoms of this disease mimic several other diseases, so it's very hard to diagnose. However, there is a distinct butterfly-shaped rash that can spread across the face in many cases. Now, pregnant women who have lupus are at a much higher risk of experiencing a miscarriage, premature birth, and a number of other complications with their pregnancy. There is no cure for this disease, but there are several medications that can be given to help manage the symptoms of lupus.
22,000 women a year are diagnosed with ovarian cancer. Although there are no known causes for this disease, the symptoms may include pelvic pain, unexplainable weight loss or weight gain, and chronic fatigue. It can be diagnosed by an MRI that may show tumors of the infected area, or x-rays that can show if the cancer had metastasized or gone to any other parts of the body. Treatment of this disease may include chemotherapy or other anti-cancer drugs that come with hair loss, nausea, and weight loss as well.
Endometrial cancer is a cancer on the membrane lining the female's uterus, the endometrium. Now, endometrial cancer has no known cause to why it may occur. Some symptoms may be abnormal vaginal bleeding, spotting, abnormal discharge, and pelvic pain. To diagnose this cancer, a pelvic and transvaginal ultrasound would be done. Now, it has been estimated for this year that over 63,000 women will have this cancer and 11,000 women will end up dying due to this cancer. Treatment for the cancer includes hormone therapy, chemotherapy, and also the removal of the full uterus.
Polycystic ovary system is a genetic disease that affects the ovaries and can cause a loss of fertility. It causes small cysts to grow on the ovaries and can cause a complete loss of menstruation, or it can cause menstruation to be sporadic. The lack of menstruation puts women with PCOS at higher risk for developing uterine cancer, so inducing menstruation with hormones should be a top priority. Effects of the disease include hirsutism, or excessive hair growth on the face, back, and arms, hormone imbalance, heart disease, and diabetes. Diagnosis is usually done through an ultrasound. The person looking at the ultrasound will look for abnormal appearance of the ovaries and thickness of the uterine lining. Since it's genetic, you can't really prevent the disease, but you can take steps to prevent the symptoms. Weight loss is important for women with PCOS who are overweight because it can reduce their chances of developing a heart disease or diabetes.
Did you know that every 1 in 1,000 women suffered from pelvic inflammatory disease? Pelvic inflammatory disease is caused when a sexually transmitted disease like chlamydia goes untreated. Symptoms of pelvic inflammatory disease are abdominal pain, pelvic pain, pain during sexual intercourse and urination, chills, fever, and fatigue. Pelvic inflammatory disease can be treated by antibiotics and sometimes surgeries.
The female reproductive system is a powerful system that should be maintained through sexual and reproductive health. If it is not maintained and kept healthy, women are not the only people that will be affected. Future generations can begin to decline without the reproductive abilities and importance of the female reproductive system.